Certainly. Bacterial vaginosis (BV) is a vaginal infection that occurs when there is an imbalance in the normal bacteria present in the vagina. Unlike some other vaginal infections, BV is not considered a sexually transmitted infection (STI), but sexual activity can increase the risk of developing BV. Here are some additional details about bacterial vaginosis. Risk factors. Sexual activity. While BV is not a sexually transmitted infection, the risk of developing BV is higher in sexually active women, especially those with multiple partners. Douching. Douching can disrupt the natural balance of bacteria in the vagina and increase the risk of BV. Smoking. There is some evidence to suggest that smoking may be a risk factor for BV. Complications. BV is generally not a serious condition, but it can lead to complications in some cases. Pregnant women with BV may have a higher risk of preterm birth or low birth rate. BV has been associated with an increased risk of acquiring certain sexually transmitted infections, including HIV. Diagnosis. Diagnosis is usually based on symptoms, a physical examination, and laboratory tests. A healthcare provider may perform a pelvic exam and examine a sample of vaginal fluid under a microscope. Treatment. BV is typically treated with antibiotics, usually oral metronidazole or clindamycin. It's important to complete the full course of antibiotics, even if symptoms improve before the medication is finished. Prevention. While it's not always possible to prevent BV, some measures may help reduce the risk. Avoiding douching. Limiting the number of sexual partners. Using condoms consistently and correctly during sexual activity. It's essential for individuals experiencing symptoms of BV to consult with a healthcare professional for an accurate diagnosis and appropriate treatment. The information provided here is for general knowledge and should not replace professional medical advice.